Are you waking up tired with less drive, less desire, and that quiet feeling that something inside you might be slowing down or shutting off? Many men notice these changes after 50 and assume it's just aging. I'm Dr. Rachel Ross, a board-certified urologist, and for over 2 decades, I've treated men just like you, strong, responsible men who were never warned about this. Because the real danger isn't aging. It's what happens when ejaculation stops, and almost no one talks about it. Tell me where you're watching from, and if men's health matters to you, gently tap, like, and subscribe. But here's what most people don't realize. Ejaculation was never just about pleasure or sex drive. Inside the male body, it serves a biological purpose that continues well beyond your younger years. Most men over 50 believe that if desire fades or opportunities decrease, ejaculation simply becomes optional, something the body can do without. But physiologically, your system doesn't see it that way at all. I often explain to my patients that ejaculation is closer to maintenance than recreation. The prostate, pelvic floor muscles, blood vessels, and nerves were all designed to function with periodic release. When that release happens regularly, fluid moves, circulation stays active, and nerve signaling remains responsive. When it stops, those systems don't shut down gracefully. They stagnate. The prostate is a good place to start. This small gland produces fluid continuously. It doesn't stop simply because ejaculation stops. When that fluid isn't released, it can thicken and accumulate. Over time, this leads to what we call prostate congestion, a subtle pressure buildup that most men don't feel as pain, but as discomfort, heaviness, or vague unease. Men will tell me, "Doctor, nothing hurts. I just don't feel right anymore." And that's usually the first warning sign. As congestion builds, inflammation quietly follows. Not dramatic inflammation that sends you to the emergency room, but low-grade chronic irritation. This inflammation can sensitize nerves around the bladder and urethra. That's why urination often changes first. A weaker stream, more urgency, waking up at night. Many men blame the prostate getting bigger, but very often it's inflammation and congestion, not size alone, causing the trouble. At the same time, blood flow signaling begins to decline. Ejaculation stimulates nitric oxide release, the same molecule responsible for healthy erections. When ejaculation becomes infrequent, nitric oxide production can decrease. The blood vessels become less responsive. Erections don't disappear overnight, but they often feel less reliable, less firm, or slower to arrive. Again, men assume this is just age, but in many cases, the signaling system simply hasn't been used. Then there's the pelvic floor, a group of muscles most men never think about until something feels wrong. These muscles contract rhythmically during ejaculation. Without that activity, they can tighten rather than relax. Chronic pelvic floor tension can create pressure in the lower abdomen, discomfort between the legs, or a sense of fullness that's difficult to describe. Some men feel restless sitting. Others notice discomfort after long drives or at night when trying to sleep. Sleep itself is another area quietly affected. Ejaculation activates the parasympathetic nervous system, the part of your nervous system responsible for relaxation and recovery. When this pathway becomes underused, men often experience lighter sleep, more nighttime. What happens? When ejaculation stops awakenings and reduced deep rest, they don't necessarily feel anxious, just wired and tired at the same time. This is why symptoms rarely appear alone. A man may notice slightly weaker erections, more nighttime urination, restless sleep, and lower abdominal discomfort all creeping in together. None of it dramatic, none of it severe, just enough to feel that something is off. And this is where shame often sneaks in. Many men hesitate to talk about ejaculation with their doctor. They worry it sounds inappropriate or irrelevant at their age, but from a medical standpoint, it's neither. It's physiology. Your body doesn't assign morality to function, it simply responds to use or non-use. One of the most important things I tell my patients is this: ejaculation frequency influences prostate circulation and nerve signaling even without intercourse. This is not about performance or comparison to younger years. It's about maintaining blood flow, movement, and neurological activity in tissues that depend on it. When that stimulation disappears for long periods, the body adapts, but not in a way that supports comfort, energy, or sexual health. The system slows, signals fade, pressure builds quietly, and once this congestion starts, it quietly triggers the next problem. One most men confuse with normal aging. Now here's the mistake most seniors make. They assume testosterone fades simply because time passes, that once you cross a certain birthday, your levels are destined to fall no matter what you do. But in clinical practice, that's not what I see. Testosterone doesn't just decline from age alone. It declines when the signaling systems that regulate it go quiet. Your testosterone production depends on constant communication between the brain and the testicles. I explain this to my patients in very simple terms. The brain sends a signal downward saying, "We need testosterone." The testicles respond. When that loop stays active, levels remain surprisingly resilient even into later decades. But when the signal weakens, production slows, not because the testicles are broken, but because they're no longer being asked to work. Ejaculation plays a role in keeping that communication alive. It activates dopamine pathways in the brain, the same pathways tied to motivation, confidence, and drive. Dopamine doesn't just affect mood, it helps regulate hormonal signaling. When ejaculation becomes infrequent or stops entirely for long periods, dopamine activity can decline. The brain receives fewer reminders that the reproductive system is still relevant. Over time, this dormancy affects morning testosterone peaks. Those early morning surges are essential. They support energy, muscle maintenance, mental sharpness, and libido throughout the day. When those peaks flatten, men begin to notice persistent fatigue. Not the kind that sleep fixes, the kind that lingers no matter how early you go to bed. Men often describe it as feeling drained without being sick. Motivation slips. Tasks feel heavier. Confidence softens. Some men tell me they don't feel sad than just flat emotionally. Muted, less assertive, less driven. And again, they assume this is aging. But when I review their history, one pattern appears repeatedly. Long-term sexual inactivity paired with zero ejaculation. Not weeks, sometimes months, sometimes years. The body adapts to what it experiences. When stimulation disappears, the brain reallocates resources elsewhere. Now, this is important. I'm not talking about compulsive behavior. Excessive stimulation can create its own problems. What we're discussing is healthy physiological release, not addiction or overuse. There is a wide difference between compulsive habits and normal biological function. The body responds best to balance. When that balance disappears entirely, the hormonal system doesn't rebel, it simply downshifts. I see this weekly in men who believe testosterone therapy is the answer. They come into my office convinced they need injections or gels. But often, when we look deeper, the issue isn't testosterone production failure. It's signaling failure. The system has gone quiet from underuse. Medication can raise numbers on a lab report, but it doesn't always restore energy, drive, or confidence if the neural pathways remain dormant. That's why some men feel disappointed even after starting therapy. The root communication loop was never addressed. True restoration begins with reawakening signaling, encouraging blood flow, stimulating nerve pathways, reminding the brain that this system still matters. When that happens, testosterone often responds more naturally than men expect. This is also why men sometimes notice improved energy before lab values change. The nervous system wakes up first. Motivation returns before numbers do. The body is testosterone and energy connection incredibly responsive when given the right cues. But while testosterone decline affects how you feel, it isn't the most dangerous consequence of stopping ejaculation. Because the real risk doesn't develop in the bloodstream or the brain. It develops lower in the body where inflammation and stagnation quietly begin to reshape long-term prostate health. But here's what most people don't realize. The prostate was never meant to sit still. It is an active gland, constantly producing fluid, constantly relying on movement and release to stay healthy. When ejaculation becomes infrequent, that fluid doesn't simply disappear. It remains inside the prostate, thickening over time and slowly changing the environment of the tissue itself. This process is called stagnation, and stagnation is where trouble begins. Without regular drainage, prostate fluid becomes concentrated. Pressure increases within the tiny ducts of the gland. This triggers irritation at a microscopic level. Not sharp pain, not something you can point to on a diagram, but a constant low-grade stress on the tissue. The immune system responds quietly, releasing inflammatory signals meant to protect. But when the stimulus never resolves, that inflammation becomes chronic. Chronic inflammation is one of the strongest drivers behind common prostate problems after 50. It contributes to benign prostatic hyperplasia, what most men know simply as an enlarged prostate, but enlargement alone isn't the full story. Inflammation makes the prostate more sensitive, more reactive, and more likely to interfere with normal urine flow, even when size changes are mild. That's why symptoms often appear inconsistently at first. Some nights you sleep through, other nights you're up twice. The urine stream weakens slightly. Starting becomes harder. emptying never feels complete. Men often assume the prostate is just getting older, but many of these symptoms are driven by congestion and inflammation rather than irreversible growth. Nighttime urination is one of the earliest clues. Inflammation irritates the bladder, neck, and surrounding nerves, sending false urgency signals to the brain. Even small amounts of urine feel like emergencies. Sleep fragments, fatigue builds, and once again, men rarely connect these dots back to prostate drainage. Research has explored this relationship for years. Multiple studies suggest that more frequent ejaculation is associated with lower prostate inflammation and reduced long-term cancer risk. This does not mean ejaculation prevents cancer. It does not mean frequency is a guarantee of protection. But the trend is consistent enough that urologists pay attention. The mechanism makes sense. Regular ejaculation helps flush stagnant fluid. It improves circulation within the gland. It reduces inflammatory load. It supports tissue turnover. In simple terms, movement prevents buildup. Yet most men are never told this. Men often say to me, "No one ever explained that." And they're right. Historically, conversations around ejaculation have been avoided in medical visits, especially with older men. There's discomfort, cultural hesitation, and the assumption that sexuality becomes irrelevant later in life. But biology doesn't retire when birthdays pass. What matters medically is not desire or frequency compared to youth. What matters is circulation, drainage, function. When ejaculation disappears entirely for long stretches, the prostate becomes one of the first organs to suffer quietly. Symptoms creep in so gradually that men adapt to them. They accept nighttime bathroom trips as normal. They tolerate weaker flow. They change routines without questioning why. But this slow adaptation often hides the underlying issue: chronic congestion. The encouraging part is that prostate tissue responds well to movement. Increased circulation improves oxygen delivery. Drainage reduces pressure. Inflammation can calm when the stimulus is removed. This is why some men notice urinary improvements even without medication when proper function is restored. The principle is simple. Prostate health explained movement plus drainage equals prostate resilience. This doesn't require extremes. It doesn't require performance pressure. It requires understanding that the gland functions best when it's allowed to do what it was designed to do. But the prostate is not the final piece of the puzzle. There's one more system affected, and it explains why sleep and erections so often decline together, leaving men confused about which problem came first. But here's what most people don't realize. Erections are neurological events first, not vascular ones. Blood flow matters, of course, but blood only moves when the nervous system tells it to. And that instruction comes from a specific branch of your nervous system designed for rest, repair, and recovery. This is called the parasympathetic nervous system. It's the same system responsible for deep sleep, digestion, and calm. Focus. When it's active, the body heals. When it's suppressed, everything becomes harder, including erections. Ejaculation plays a role in keeping this system responsive. It stimulates parasympathetic activity and reinforces the brain-body loop that allows sexual function to occur naturally. One of the earliest signs that this circuit is weakening appears at night. Healthy men experience several spontaneous erections during sleep, particularly during REM cycles. These nighttime erections are not about desire, they're maintenance events. They deliver oxygen to penile tissue, preserve elasticity, and confirm that nerve pathways are intact. Urologists view them as a vital health marker. When ejaculation becomes infrequent, this system receives less stimulation. Over time, nighttime erections may become weaker or disappear altogether. Many men never notice because they're asleep, but the body notices. Without these events, oxygenation decreases, responsiveness fades, erections during waking hours become less reliable. At the same time, sleep quality often declines. REM sleep depends on parasympathetic dominance. When the nervous system struggles to shift fully into that mode, men experience lighter sleep, more awakenings, and less restorative rest. They may sleep for 7 or 8 hours, but wake feeling unrefreshed. This is where anxiety can quietly creep in. Poor sleep increases cortisol. Elevated cortisol suppresses testosterone and nitric oxide signaling. Nitric oxide, again, is essential for erections. The system becomes caught in a loop. Weaker erections lead to worry. Worry disrupts sleep, and poor sleep further weakens erections. Men often tell me these problems started together. "Doctor, my sleep got worse around the same time my erections changed." That's not coincidence. It's shared nervous system dysregulation. Inactivity reinforces the decline. When sexual stimulation and ejaculation disappear entirely, the parasympathetic system is used less frequently. In that context, the body prioritizes survival pathways instead: stress, alertness, vigilance. Over time, relaxation becomes harder to access. Even moments of calm feel shallow. This doesn't mean damage is permanent. It means the system has adapted to underuse. The nervous system is remarkably plastic. It strengthens what it practices. When proper stimulation returns gradually, safely without pressure, responsiveness often follows. Nighttime erections may reappear. Sleep can deepen, anxiety can soften. Re-engaging the system isn't about forcing performance. It's about restoring communication, encouraging blood flow, allowing neurological pathways to remember their function. I've seen men in their 60s and 70s experience meaningful improvement once this loop begins to wake up again. Not perfection, not youth, but stability, comfort, confidence. And now here's the most important part, because even if this has been going on for years, it is not permanent. But here's what I want you to hear clearly. You didn't fail, you weren't careless, and you certainly weren't broken. What you're experiencing is not a personal shortcoming or a lost sleep, erections, and nervous system of masculinity. It's a biological response to silence. When the body stops receiving certain signals, it doesn't punish you. It simply adapts. Many men carry quiet shame around this topic. They worry that reduced ejaculation means something fundamental about their manhood has disappeared. They don't say it out loud, but they feel it. A sense of loss, a feeling of being less than they once were. I want you to understand something important. Function fading does not equal identity fading. Your worth was never tied to performance. Aging is not a shutdown. It's an adaptation process. The body reallocates energy. Systems that aren't stimulated gradually quiet down, not because they're damaged, but because the brain is efficient. It supports what it believes you still need. That's why this conversation matters. Because once the body receives new information, it can respond. The nervous system is plastic. It can rewire at any age. Hormonal systems remain responsive far longer than most men realize. Circulation improves when movement returns. These are not theories. They are patterns I've watched unfold repeatedly in clinical practice. I've seen men in their 60s and 70s regain function. Not perfectly, not like they were 30 again, but meaningfully. Better sleep, stronger morning energy, improved urinary comfort, renewed confidence in their bodies. Not because they forced anything, but because they restored communication. The body doesn't require intensity. It requires consistency. It doesn't need pressure. It needs permission. There is dignity in taking responsibility for your health, not through fear or panic, but through understanding. When you know what your body expects, you can meet it halfway. But your body does need a signal to stay alive. It needs movement to maintain circulation. It needs stimulation to preserve nerve pathways. It needs reminders that these systems still matter. That's not weakness, that's biology. When men realize this, something shifts emotionally. The fear eases. Confusion gives way to clarity. Instead of feeling like something has been lost forever, they begin to see that something has simply gone quiet, and quiet systems can be awakened. That brings us to what I tell every man who sits across from me in my clinic. But here's what I want you to hear clearly. You didn't fail, you weren't careless, and you certainly weren't broken. What you're experiencing is not a personal shortcoming or a loss of masculinity. It's a biological response to silence. When the body stops receiving certain signals, it doesn't punish you. It simply adapts. Many men carry quiet shame around this topic. They worry that reduced ejaculation means something fundamental about their manhood has disappeared. They don't say it out loud, but they feel it. A sense of loss, a subtle embarrassment, a fear that maybe this is just how life is now. I want you to understand something important. Function fading does not equal identity fading. Your value was never measured by performance. Aging is not a shutdown. It's an adaptation. The body reallocates what to do now, energy toward what it believes you still need. Systems that are used stay supported. Systems that fall silent begin to conserve. That doesn't mean they're damaged. It means they're waiting. This is where hope lives. The nervous system is remarkably flexible. Neural pathways can strengthen again at any age. Hormonal systems remain responsive far longer than most men are told. Circulation improves when tissues are encouraged to move and receive oxygen. These are not motivational ideas. They are observable medical realities. I've watched men in their 60s and 70s regain function. Not perfectly, not like they were in their 20s, but meaningfully. They sleep deeper, they wake with more energy, urinary symptoms soften, erections become more reliable, confidence returns quietly without pressure or force. Not because they chased youth, but because they restored communication. The body responds when it's reminded what it was built to do. It doesn't require intensity. It doesn't demand perfection. It responds to consistency and understanding. Gentle signals repeated over time often outperform aggressive attempts that come from fear. There is strength in responsibility, not panic, not shame. Responsibility means learning what your body expects and giving it the opportunity to respond. But your body does need a signal to stay alive. It needs circulation to prevent stagnation. It needs stimulation to preserve nerve pathways. It needs reminders that these systems still matter even now. That isn't weakness, that's biology. When men understand this, something powerful happens. The fear loosens its grip. Confusion turns into clarity. Instead of feeling like something has been lost forever, they realize something has simply gone quiet, and quiet systems can awaken again. And that brings us to what I tell every man who sits across from me in my clinic. If this video helped you understand your body better, I want to thank you for spending this time with me. I know these topics aren't always easy to hear or talk about, but understanding is the first step toward control. My goal here is simple: to give you clear, honest guidance so you can make decisions from knowledge, not fear. If you'd like to continue learning, I invite you to subscribe and join a community of men who are taking their health seriously. This channel exists for men like you, men who want strength, clarity, and confidence as they age, not confusion or quiet decline. You are not alone in this. Thousands of men are asking the same questions and taking the same steps forward because real masculinity isn't denial. It's responsibility. It's self-respect. It's choosing to care for your body so it can continue to support the life you want to live. That tiredness you've been feeling, that fading drive, that quiet concern you may have carried for months or years. Now you know it isn't just age. It isn't inevitability. It's information your body has been trying to send. Your body isn't broken. It's waiting for leadership. You deserve confidence. You deserve energy, and you deserve deep, restorative sleep. Take care of your health because you are worth